How's it going, guys? Pass level question for endocrine immuno for step one. If you think this question's too easy, not my opinion, you need to know the high yield stuff for USMLE students still fuck this up. So 33-year-old woman, she has Graves' disease. So it's a pass level diagnosis. You say, what's the relevance of the SLE here? Well, as I've inculcated in my prior clips, autoimmune diseases go together. You don't have to worry about strict HLA associations. The vignette could tell you that the patient or a family member has another autoimmune disease, e.g., vitiligo, IBD, RA, SLE, it doesn't matter. And the implication is that they're telling you there's an autoimmune disease. And it's not to digress, but just to reinforce the point. For example, they could tell you patient has B12 deficiency and say he or she also has vitiligo. And the implication is that he or she has B12 deficiency secondary to pernicious anemia because autoimmune diseases go together. So let's just hop through the answer choice here. What antibodies we see in this patient? Choice A, antimicrosomal, wrong fucking answer. First, Hashimoto thyroiditis. So Hashimoto, obviously hypothyroidism, not hyperthyroidism. So decreased T3, T4, up arrow, TSH. USMLE wants you to know that you have a lymphocytic infiltrate within the thyroid gland. You need to know that not only are you going to have the very buzzy cold intolerance, constipation, dry, doughy skin, brittle hair, but you need to be aware of other findings such as menstrual irregularities, dysthymia/depression, transaminitis. So you can get increased ALT and or AST. I've talked about that in my prior clips. You can get hypothyroid myopathy, increased creatine kinase. Okay, very important findings. So antimicrosomal, wrong fucking answer. Choice B, antimitochondrial, wrong fucking answer. So this is for PBC, primary biliary cirrhosis. It can be a woman, 20s to 50s, who's got generalized pruritus, high cholesterol, jaundice, increased direct bilirubin, ALP, and they can tell you that one of her family members has an autoimmune disease via what I just talked about before about autoimmune diseases going together. They can tell you that there's a stone visualized in the gallbladder, which will really confuse some students when they give you hepatobiliary differentials such as choledochothiasis, etc., up against PBC. Well, she's got high cholesterol, right? So you could get a cholesterol stone incidentally in the gallbladder. And you can also give ursodiol, ursodeoxycholic acid, as a treatment for this condition. Wrong fucking answer. Choice C, antithyroid peroxidase, wrong fucking answer. So it's the same thing as antimicrosomal. Some of you probably astute and you knew that. Okay, so it's for Hashimoto. So antithyroid peroxidase, aka antimicrosomal, antithyroglobulin. These are three antibody names that you need to know for Hashimoto thyroiditis. Choice C, wrong fucking answer. Choice D, antithyroid receptor, correct answer. Graves' disease. Okay, so primary hyperthyroidism. So thyrotropin is another name for TSH, thyroid stimulating hormone. Now, this isn't me being an asshole. This is what NBME will do sometimes. If you think, oh, this is a gotcha question, not really, because even if you didn't know going into this question that TSH is also known as thyrotropin, even if you didn't know that, you can eliminate the others easily to get there. You know A and C are Hashimoto. You know choice B is primary biliary cirrhosis. And then if you're left between D and E, you say, well, never fucking heard of E before. So, and that's anti-T3. Never heard of that before. And if we had anti-T3, that could possibly be a cause of hypothyroidism as just a theoretical. So choice D is the best answer here. So Graves' disease, they want you to know that you treat with thionamides such as propylthiouracil, methimazole. Both of those inhibit thyroid peroxidase. PTU also has the added function of inhibiting 5-deiodinase peripheral conversion of T4 to T3. Both can cause agranulocytosis, i.e. neutropenia. And you're going to treat thyroid storm not with methimazole, but they'll give PTU classically because it has that added MOA, in addition to steroids, which helps the ophthalmopathy, the proptosis ex ophthalmos. Also potassium iodide, which shuts off the thyroid gland, as well as propranolol, which is used for tachycardia, additionally shuts off conversion of T4 to T3. Choice E, wrong fucking answer. You know the deal. To make more content, if you like my stuff, subscribe my channel. And I appreciate your time. That's it.